Welcome to part 2 of inflammation and chronic disease. Here we return to our deep dive into inflammation, arthritis, and the latest scientific breakthroughs in treatment. If you haven't listened to part 1 yet, I highly recommend you go back and check it out first. In that episode, we explored what inflammation is, how it develops, and its role in chronic disease, including arthritis, cardiovascular conditions, and neurodegenerative disorders. Today, we're shifting our focus to how science is actively addressing chronic inflammation through advanced medications, dietary interventions, gut health research, and emerging biotechnologies. We'll break down biologic therapies, precision medicine, phytotherapy, and even AI-driven treatments that are shaping the future of inflammation management. So, let's get started. In part 1, we covered the biology of inflammation, its role in disease, and how chronic inflammation contributes to conditions like arthritis, cardiovascular disease, and neurodegenerative disorders. But how do we treat it? What does the latest research tell us about medications, biologic therapies, diet, and phytotherapy in reducing chronic inflammation? And what emerging treatments are showing promise in managing inflammatory diseases? Today, we'll look at scientific advancements, pharmaceutical innovations, and lifestyle interventions that are changing the way we approach inflammation treatment. Inflammation has been a therapeutic target for decades, with drugs like non-steroidal anti-inflammatory drugs, NSAIDs, corticosteroids, and disease-modifying anti-rheumatic drugs, DMARDs, being widely used. However, research now shows that more precise and personalized treatments are needed to balance the immune system without excessive suppression. A major development in inflammation treatment has been the rise of biologic drugs. Biologics are genetically engineered medications that target specific molecules in the immune system. One of the most widely studied biologics is commonly known as Humira, which blocks a cytokine that drives inflammation in autoimmune diseases. A meta-analysis published in the BMJ found that inhibitors, including Humira, significantly reduce inflammation and joint damage in rheumatoid arthritis patients compared to traditional DMARDs. Newer inhibitors, such as tofacitinib and baricitinib, have also shown promise in blocking inflammatory pathways. A 2022 study in the Lancet Rheumatology revealed that JAK inhibitors provide faster symptom relief and better joint preservation in arthritis patients than conventional therapies. Beyond pharmaceuticals, there's growing interest in how diet can modulate inflammation. A 2021 BMJ, Nutrition, Prevention and Health study, found that patients who followed a Mediterranean diet for 12 weeks showed a 30% reduction in inflammatory biomarkers like CRP and IL-6. This diet, rich in olive oil, fatty fish, nuts, whole grains, and leafy greens, has been shown to lower oxidative stress, reduce inflammatory cytokines, and improve gut health. Similarly, the DASH diet, originally designed for blood pressure control, has also been linked to lower systemic inflammation. A randomized controlled trial published in the Journal of the American College of Cardiology demonstrated that the DASH diet significantly reduces vascular inflammation in hypertensive individuals, making it a powerful tool for cardiovascular health. In addition to dietary patterns, certain bioactive compounds found in foods have been extensively researched for their anti-inflammatory properties. Curcumin, the active compound in turmeric, has been widely studied for its ability to block inflammatory pathways, including the key signaling pathways. A 2023 meta-analysis in the British Journal of Pharmacology found that curcumin supplementation reduces CRP levels and improves symptoms in patients with osteoarthritis and inflammatory bowel disease. Another powerful anti-inflammatory compound is resveratrol, found in red grapes, berries, and peanuts. A systematic review published in the European Journal of Clinical Nutrition concluded that resveratrol has significant anti-inflammatory effects in metabolic syndrome patients, improving insulin sensitivity and reducing oxidative stress. Beyond nutrition, the gut microbiome has emerged as a key regulator of inflammation. A groundbreaking study in Nature Medicine found that individuals with a higher diversity of gut bacteria had lower levels of systemic inflammation, independent of diet and exercise. Probiotics, such as lactobacillus and bifidobacterium strains, have been shown to reduce inflammatory cytokines, improve gut barrier function, and even modulate immune responses. This is leading researchers to explore how microbiome-targeted therapies, including personalized probiotics and fecal microbiota transplants, may help treat inflammatory diseases. As we're coming to the end of this episode, I want to take a moment to talk about Unicate College. If you're interested in exploring the science behind inflammation and the latest research in biomedicine, clinical nutrition, and phytotherapy, Unicate College offers specialized courses designed to deepen your understanding of these fields. Whether you're a healthcare professional or simply passionate about scientific advancements, visit Unicate College to explore your next step. Looking ahead, the future of inflammation treatment is shifting toward precision medicine and AI-driven drug discovery. Researchers are now using machine learning algorithms to predict which patients will respond best to specific anti-inflammatory therapies. A 2023 study in the New England Journal of Medicine demonstrated that AI-driven models can predict treatment outcomes in rheumatoid arthritis patients with 85% accuracy. Beyond AI, gene editing technologies like CRISPR are being explored as potential ways to suppress overactive inflammatory responses. A preliminary study in the Journal of Clinical Investigation showed that CRISPR could be used to deactivate inflammatory genes in animal models, paving the way for future human trials. Inflammation research is one of the most rapidly advancing areas in medicine, with ongoing discoveries in pharmacology, nutrition, microbiome science, and genetics. From biologic drugs and dietary interventions to AI-driven treatments and gene editing, the future of inflammation management is evolving toward more precise and personalized approaches. If today's discussion has sparked your interest, I encourage you to continue exploring the latest research in inflammation science and its impact on chronic disease. Thank you for joining me on Unicate Talks, where we break down the latest in health, science, and medicine. Stay curious, stay informed, and until next time, keep learning.